Most people wait until something is hurting before they go to the dentist, but by then it's more involved, more expensive, and more stressful. I'm going to give you 10 signs to look out for that would be an indication that you want to go to the dentist. I'm Dr. Dill with Nooga Dentistry. Let's get started. All right, let's start with the obvious one, pain. Most people are worried about going to the dentist when they're in pain. Pain generally means that there's infection or that there's something that is causing irritation to the nerve. The sooner we see you, the smaller the problem, the easier the fix. What about sensitivity? A lot of times people think that sensitivity is just normal, and it can be, but if it's lingering, then sensitivity is not normal. So if you drink something really hot or really cold, that's just telling you that your nerve is alive and you feel it in your teeth. However, if it lingers, that is an indication that there's some sort of irritation with your nerve. And that would be a sign that you would want to go see a dentist so that we can figure out whether this is normal or whether this is something that is abnormal and not something that you're actually seeing. When it comes to sensitivity, if we wait, that could turn into something that is a lot more involved. For example, like a root canal, the dreaded root canal. So the sooner we catch something like this, the less likely the chance is that you're going to need something more involved. All right, let's go to the next side. What about bleeding gums? A lot of times people come into the dental office and they're like, yeah, when I floss, my gums bleed. Well, if you think about it, if you have like a wound or a scab or something like that and you hit it, you don't have to hit it that hard and it bleeds, right? But your healthy skin wouldn't necessarily bleed if you bumped it. Well, that's what's happening with our gums. As our gums get infected or irritated, they swell up, hence the inflammation. And anytime something bumps it, like floss or food or something like that, a toothbrush, it can cause bleeding. So bleeding gums is an indication that your gums are not healthy. Why does that matter in the long run? Because your gums dictate where the bone is, and your bone is what holds the teeth in. So if your gums cause your bone to go away, your bone causes your teeth to go away. We want to help keep your teeth by making sure that you have healthy gums. All right, let's move to the next issue, bad breath. A lot of times people will struggle with bad breath and they ask us, where is that coming from? Oftentimes it may just be coming from not brushing the tongue. The tongue is the number one reason why bad breath may exist. However, if you do a good job brushing your teeth, brushing your tongue, and using mouth rinse that kills the bacteria, then this would be an indication that maybe something else is going on in your mouth that you can't necessarily see or detect. It might be something going on between your teeth or under your gums, and it might mean that you need a deeper cleaning, or it could be that there's some sort of cavity or decay that's starting to occur because that harbors bacteria that then also creates a bad odor. An early visit to your dentist will help you be able to determine whether or not there's some sort of infection or decay that's occurring. And the earlier we catch it, the easier the treatment, the less stressful the treatment, and the less expensive the treatment. All right, let's move on to the next one, swollen, red, or tender gums. Now this differs a little bit from bleeding gums because a lot of times bleeding gums may be coming from some sort of a local irritant that's in your mouth, but swollen, red, or tender gums could be coming from something that's in the blood, or it could be coming from something that's involved with the tooth. And these would be all indications that something deeper, something a little less obvious is probably what's going on, and it would be good to be evaluated by a dentist so that you can get this resolved before it gets hairy. What about a tooth that changes colors? Even if it's subtle, there's a reason why it's changing colors. Maybe it's just something pretty minor like external stain, and you can choose whether or not you'd want to whiten that tooth or not. And then sometimes it has to do with the internal side. It could be that the nerve is dying. That tooth has maybe been traumatized. Either it's been traumatized because it took one good pop, or it's been traumatized because maybe you've been biting or chewing on it incorrectly. No matter the reason, this is something that you would want your dentist to take a look at because you would much rather jump on this sooner rather than later. If you wait, this could end up blowing up on you in a short amount of time. You just wake up, or you're out of town, or you're on vacation, whatever the case may be, and all of a sudden this tooth is now severely infected and possibly even swollen. The reason it's changing color is because you don't have that blood supply going in and out of the tooth anymore. And so once it dies, that blood that's in there, it just kind of leaches out into the tooth, and it changes the shade of the tooth. So this is something that a dentist can detect, take an x-ray, and see what treatment's needed. What about jaw pain, clicking, or headaches? This is all related to either clenching or grinding your teeth when you don't know it. Sometimes it's during the day, sometimes it's at night. But if you put your fingers right here and you bite together on your back teeth, you'll feel that flex. The muscles that work your jaw, they go up here onto your skull. And a lot of times you feel like you've got this deep down pain coming from inside your head, like on your brain, but it's actually the muscles that are attached up here at your skull. These muscles right here, your sternocleidomastoid muscle, that right there can be sore, so you can have pain all up through here. You can have pain come down your jaw, and then you can have pain fanning out up here and kind of going in behind your eye. We can help you with this. This is actually a much simpler fix than what most people think, because we actually have a splint that you can wear that will prevent you from being able to apply all these stresses and pressures to your teeth that are causing all of this muscle pain. This is a sign that you really want to see the dentist, and I love seeing patients for this, because this is one of those things that most people don't know that we can help, and we can completely change somebody's quality of life. Super excited to talk about this one. All right, guys, what about another symptom? Loose teeth. This is one that a lot of times people think that it's just part of life, having a loose tooth. And it's probably because we go through the stage as, kids, and we get loose teeth and everything. But as kids, we know what happens. They fall out. That's what it eventually happens. So with loose teeth with adults, they don't tighten back up eventually. A lot of times adults think, oh, well, if I just take it easy on it, it'll start to tighten back up. But the real thing is like, why is it loose? That's why you got to come see us, so that we can determine why it's loose. And if one tooth gets loose, it's kind of that domino effect. One tooth gets loose, you lose it. The next tooth gets loose, you lose it. Sometimes these loose teeth, and actually I'd probably go as far as to say that most of the time they don't even have pain, they just get loose. But you're going to end up losing the tooth. Early intervention helps save that tooth, but more than that, it helps save the rest of your teeth too. And there's nothing like what God gave you. It's way better to have your natural teeth than it is to have replacement teeth. It's less expensive, plus it's just better. Another sign that you may need to see a dentist is if you haven't been to the dentist in over a year. Now, the reason that this is important is because a lot of times our teeth don't necessarily start to have major symptoms. They may have little things, but think about it. Our teeth are made out of enamel, and that's the hardest substance in our body. They're pretty resilient, and they don't really start to create pain until they get fairly advanced. So it's really important that you get in to see us so that we can take a look, do a little checkup, and we can fix things when they're easy and they're not that expensive and they're a lot less stressful for you guys. So come see the dentist if you haven't been in within the last year. We really want to see you every 6 months. That way we catch things when they're itty bitty small. And the next symptom that you should go see a dentist is when something just doesn't feel right. Oftentimes, it's like these vague things. You can't really pinpoint why it hurts, when it hurts. Like sometimes it feels like it's sore or it hurts and then it stops and it goes away. These all have reasons to why it's occurring. For example, let's say a tooth is fractured. Well, a fracture just doesn't run up and down and back and forth. It may run at these weird oblique angles. And so like you have to hit it just right to get it to hurt with just the right amount of pressure. So sometimes you eat and you feel discomfort, and sometimes not. And you just can't determine whether or not you have a problem. These are all really good indications that you should get in to see a dentist, because these things you want to jump on and identify at a very earlier stage, because the treatment is a lot less invasive when it comes to these sorts of things. All right, guys, if you're experiencing any of these symptoms, don't wait. We here at Nooga Dentistry, we want to catch these problems early on and clearly explain your options and make sure that you're taken care of in as comfortable of a way as possible. If you're in the Chattanooga area, you can schedule an appointment with us during our business hours, Monday through Thursday, 8 to 5, and on Fridays, 8 to 2. If you liked this video and it was helpful, please like and subscribe. And please share this with somebody that you know has maybe been putting off going to the dentist. We'll see you soon.